So OCPs is oral contraceptive medications, pills, usually given to contraception to married couples, but they have a very good and important role in these patients as well, in dysmenorrhea as well.
Letting professionals talk, by letting them create an awareness, because we all have been following, it's been centuries that we've been following what we are told to.
Dysmenorrhea, the parents or the caregivers should not hide it, should go to the doctor and tell them about it. So there are certain if the pain is very severe, if the pain is mild or moderate and the child is bearing it,
Period pain often misunderstood, frequently dismissed. Today, we separate myths from medical facts with leading experts in general medicine, pediatrics, and psychology. Debunking common myths about causes and treatments.
So OCPs is oral contraceptive medications, pills, usually given to contraception to married couples, but they have a very good and important role in these patients as well, in dysmenorrhea as well. And the main myth, the main question the mother starts asking is that these are the drugs which she had taken for contraception, and the girl is not married. Why are we giving it? And it will cause infertility or some other problems. So OCPs, we need to understand these oral contraceptive pills are the pills which are going to suppress the system. When they are suppressing, then they will relieve the pain. So it will be, they will improve the hormonal profile of the body. So in this way, the dysmenorrhea will improve. These pills will not lead to infertility. These pills will not cause problems in the future, and they are not being given for long term. It will be given for 3 months or 4 months just to make the hormonal environment of the body in a way and that patient doesn't have high progesterone levels or estrogen levels, which causes all this problem. So they are going to help her. And that's the main myth, and that's the main problem of giving OCPs. OCPs are good here. We need to remember that.
Letting professionals talk, by letting them create an awareness, because we all have been following, it's been centuries that we've been following what we are told to. And because of this being such a taboo topic, we are not actually talking about all of these. And once once we are creating an open ground for professionals to come forward and talk about these, I think we can debunk a lot of those myths.
like first of all, if the young girl or an adolescent is having dysmenorrhea, the parents or the caregivers should not hide it, should go to the doctor and tell them about it. So there are certain if the pain is very severe, if the pain is mild or moderate and the child is bearing it, then and it gets settled on common medications like anti-inflammatory drugs. So it can be without any cause, which is really called primary dysmenorrhea, in which we do not find any cause. It's just dysmenorrhea which is due to the menstrual blood flow and in the initial 2 or 3 days. But if the girl is having, or an adolescent is having, or at any age woman is having severe pain during dysmenorrhea, it should get investigated. There are common, very easy tests which we can do to rule out any pathology or rule out any disease if it is there. For example, you can do the ultrasound, and ultrasound can rule out any cyst in the ovary, any fibroids, or there are small tumor-like thing in the non-benign tumor-like things in the uterus which can cause severe pain during the menstrual cycle, which are usually called fibroids. Sometimes they are there which are causing severe pain. Sometimes there is an infection which can cause severe pain. So we can always do some investigation and can diagnose these things, and then these things can all of them usually gets easily treated. And one very important cause which I want to mention is the endometriosis. It is also not uncommon, and if it is there, it can get treated, and you can consult the young girls can consult to the pediatrician or pediatric endocrinologist, or the elder woman can go to a gynecologist, and they can diagnose it and they can treat it very easily. So there is no need to hide it. One should get it. If the girl is having dysmenorrhea or having severe pain, an ultrasound is a must for every girl, every woman of any age. That is my message. And if you can diagnose it early, you can treat it properly. And almost all of them can get treated very easily.
The importance of evidence-based approaches to patient care.
So evidence-based is very important. We cannot say that that other girl was given this, that's why she has improved. Yeah, people come and say that my sister-in-law's daughter had, and they were taking this medicine, so should I? No, it's not like that. Evidence-based is evidence-based. It has been seen in many patients. There are researches which have been done, and then we come to conclusion that this is safe to be given to the patient. So we have to be safe in the end. We are giving benefit with safety to the patient. We have to be safe as well. So evidence-based will tell us that this medicine, just like evidence-based has shown us NSAIDs help, evidence-based has shown us that OCPs help these patients. So these are the drugs which have to be given to these patients. So evidence-based has a very important role in all the treatment modalities, in all the diseases.
What are evidence-based approaches? Evidence-based approaches are those that have been proven to help patients all over the world. So we need to emphasize them, we need to inculcate those in our therapeutic process, in our treatment process to help women in general.
Yes, obviously, if you are hiding it and if you are not investigating it, always it's very important. You should know what is the actual diagnosis and why it is causing what is causing so much pain. So first you know the cause, and then you can treat it appropriately. If you are hiding it and if you are not just delaying it for the sake of no, nothing is going to happen, or we have to go to a doctor, or something will come out and something which may be untreatable, there is something wrong, we cannot hide from it. So I think if you can diagnose it early, and you can treat it properly, and you can treat it very easily. So my advice through your program is this, that if any girl or any woman is having severe pain, or maybe severe pain, or they are not having, previously there was no pain and now they are having pain during the cycle, it should get investigated, ultrasound should be done, and they should consult a proper doctor. And 99% it can get treated very easily.
Empowering patients starts with knowledge. Let's continue the conversation and advocate for evidence-based care.